This is the treatment plan for case 303, loading the DICOM data and rendering it 3D. Here we go, looking at the maxillary area that was cropped. So looking at the right side in here, as you can see right here, 2, 3, 4 area, it looks like we have bone there. As we go to number 5 area and then number 6, we have a major defect. And then number 7, we still have a little bit of bone left in there. But as we get to 8, 9, 10, 11 area right here, notice the big defect in here around 11 and around 10 area that will be necessary to graft with a pericardial membrane and maybe split rigid here so we can give her some good lip support. The sinuses go too far forward to the canine, and as we go back to 13, 14, 15 area, the only area that we could possibly put implants in here is going to be somewhere in the range of 13 and maybe 14 and 15 in order to capture some good bone. So looking at the coronal slice right here, looks like the coronal slice show us right here as well, but on the lingual of number 15 and number 2, there's some good bone in there that we may be able to capture some bone, some areas to place good implants in there. I will proceed to show you the details next. So in the reverse engineering process, we went ahead and just utilized the partial denture as the AP position for the teeth, to utilize it to dictate the AP position of the teeth pretty much. We segmented the roots of the posteriors and the ones that are existing, and then we added some more teeth in there. Let me remove the tissue area right here, and as you can see, this is the area where we added some teeth. I added 8, 9, 10 area there, and then here are the existing roots of number 11, number 6, number 7, and then all the other ones. So we will utilize this as a guide so we can proceed and place some implants in there. This will be a nice challenging case, as I said. Then I will go ahead and show you how I plan to place a bunch of implants, and you get a chance to decide which ones you want to use, which ones you don't want to use. But this is definitely not an all-on-4 case or an all-on-6. It's probably going to be an all-on-8 kind of case, but I'll leave it up to you to make that decision. So I'm going to start peeling off the layers. I'm going to remove the tissue from here. Now I'm going to remove the bone, and I'll show you the right side as I have planned it. So on the right side, as I have planned it right here, I placed implants on tooth number 3, number 4, number 5, number 6, and number 8 as well. And I'll let you pick and choose in terms of what is the best ones to proceed. Of course, you will definitely need a sinus graft in there. If I place the bone back in there again and remove the volume view and flip this view right here, you will notice that there's definitely going to be a nice sinus graft that will be necessary to get this case to work. So let me just go back to the same thing, remove the ball, and I will start by placing the cross slicer view on some of these areas that we are talking about, starting with tooth number 3 on the right side. So I'll start with tooth number 3, and as you can see over here on tooth number 3, I'm putting it right in between the roots that are in there, and I'm going to propose a 5/0 by 11.5, and as you can see, it's going to go right up into the sinus area in here. We could easily put a 6/0 as well if need be to get some good initial stability in there, but I'd like it to engage to the subnasal, to the subfloor of the sinus area right there. So you will be able to use either a 5/0 by 11.5 or a 6/0 by 11.5 on tooth number 3. So we're going to go to the next implant, which is tooth number 4, and as you can see, I'm trying to make it a little bit more mesial to the root of tooth number 4 that's in there. And as you can see in the 2D view in here, the root kind of takes the buccal lingual roots. There's 2 roots in here, takes pretty much most of the width of the ridge that's in there, and I'm proposing a 4.3 by 10, and as you can see, we're in the sinus, and we may even use an 11.5 if possible, if we decide to do a socket lift or a sinus graft that's in there. So this will be a 4.3 by 10 or possibly an 11.5 with a sinus graft that's in there. So the next implant will be on tooth number 6 right there, right on the canine, and I'm gonna do the same thing. I'm gonna try to put it a little bit more palatal so we can engage some native bone that's in there, and I'm gonna go ahead and propose here in the 2D view a 4.3 by 13 millimeter. We're gonna basically be encroaching into the sinus area in there, but that's gonna need this little 1/3 of this implant that's gonna engage in native bone. So that will be a 4.3 by 13 millimeters again. This is the position for tooth number 7 right now, and as you can see in here, tooth number 7 has very narrow ridge, and if we put the bone in there we could see it. And if we look at the 2D view in here, as you can see, we've got to be very careful extracting this tooth if we decide to put that implant in this position. This is going to be a 3.5 by 13 millimeter implant, and you're going to need a careful extraction of this tooth in order to level this right on the same level with the implant on tooth number 6. So if I remove the bone one more time, you will see that tooth number 6 and tooth number 7 are going to be on the same level as far as the depth is concerned. And if I remove the roots in there, this is where we are on tooth number 6 and tooth number 7. We may decide not to put number 7 at all and choose the position of the implant on tooth number 8 as we proceed. This is the implant on tooth number 8 now, and as you can see one more time, I'm proposing to place that on tooth number 8 only because there's ample bone in here and we could possibly use it. And if I come to the 2D view right here, this is going to be a 4.3 by 10 as you can see in here, and we have plenty of bone and we're away from the nasopalatine area, so we should definitely consider placing number 8 rather than number 7. If I were to place the bone in here one more time, notice there's a better width in here with a 4.3 by 10. We should be able to get a nice implant as far as to determine the AP position of the implants for biomechanics. I will go ahead and show you the left side, which will be a little bit more challenging next. So the next implant will be on tooth number 9, and it would be ideal, as I showed you before, to have the 8 and 9 implants as the anterior most position for the biomechanical reason. Removing the bone in here, as you can see the defect that we have in here, I placed an implant in there, and this will be a 3.5 by 10 millimeters. I would have liked to put a 4.3 in there, but unfortunately we cannot. So I chose a 3.5 by 10 only because of the proximity to the nasopalatine area in here. So still a 3.5 is better than nothing in terms of determining the AP position of these two anterior most implants that will be in here. So this will be a 3.5 by 10 millimeters. The next implant I'm going to propose, again for the biomechanical consideration, is going to be around tooth number 11 area, as you can see right in here. And the only reason for that is because, as you can see, the bone level right here around 12 and 13 is going to be impossible to place an implant in there. And to augment vertically, to get vertical height, is going to be practically difficult. So it would be ideal to just place the implant on tooth number 11 rather than tooth number 12 or tooth number 13. So here it is, tooth number 11 implant. I'm placing it. Again, it's going to be right here, again anterior to the sinuses that are present, that are in there. So this area we will be pretty much in good bone. As you can see the 2D view in here, I'm proposing a 3.5 by 10 millimeter implant as well. We could basically augment a little bit more on the buccal lingual area as well, and secure the bone around this implant, because this is the transition for the cross-arch stabilization of the implants proposed. We will not be able to place implants on 12 and 13, so we will go ahead to number 14 and 15 next. So the next implant I'm going to propose is going to be in the tooth number 14 region right here. And if I remove the bone very quickly, notice that we can put this implant apical to the roots of this tooth right around here, and we could see in the 2D view right around here that we should be able to stick this implant into the sinus area and augment the sinus floor right here and do a little sinus graft. So this will be a 5.0 by 10 millimeter implant that will be present on tooth number 14, and I will take you to show you number 15 next. Number 15 as well is going to be a 5.0 by 10 millimeter implant as well, and the reason for that is going to be distalizing this implant towards the distal root so we can engage some more fresh bone that's in there. And we could use a 10, we could use an 11.5 if we're going to be doing a sinus graft in here. I would choose both of them to be an 11.5 millimeters and just put some more bone in the sinus floor. So you're going to have to make some decisions in this case and let me know exactly which implants you would like to keep and which implants you would like to remove. I will give you my recommendations in a moment. So here is my final recommendations for this case. Looking on the left side, again, as you could see, we will need to place implants on tooth number 9, number 11, number 14, and number 15. That's the only spots we could place implants in there. Going to the right side again, on the right side, it's ideal to place implants on tooth number 3, number 4, number 6, and number 8. We will not be placing an implant on number 7, and we cannot place an implant on tooth number 2 simply because there's wide roots that are fused in the middle. There's no interseptal bone. So placing the implant on tooth number 3 right in the middle of the interseptal bone is going to be much better to get a much better stability. And we could possibly, since we're going to be doing a sinus lift, instead of using an 11.5, we could use a 13. And we could use, even instead of a 10 on number 4, we could use again an 11.5 or a 13 as well, since we're going to be doing a sinus graft. So this, my recommendation will be an all on 8 on this case. And there's a very good chance that in terms of initial stability of some of these implants, that we may have to use 5s or 6s in the molars in order to achieve the initial stability for these implants, so you don't have to do it twice. So this should conclude the treatment plan for case 303.